HIV, or the human immunodeficiency virus, is a virus that attacks the body's immune system. This virus specifically targets and destroys a type of white blood cell called CD4 cells, which are crucial for maintaining a healthy immune response. Without these cells, the body becomes vulnerable to a wide range of infections and diseases that it would normally be able to fend off. This system is our body's defense mechanism against infections and diseases. The immune system is composed of various cells, tissues, and organs that work together to protect the body. White blood cells, including CD4 cells, play a key role in identifying and destroying harmful pathogens. HIV weakens the immune system, making it harder for the body to fight off illnesses. As the virus replicates, it reduces the number of CD4 cells, weakening the immune system over time. This can lead to symptoms such as fever, fatigue, and swollen lymph nodes, which are often the first signs of HIV infection. HIV is transmitted through certain bodily fluids. These fluids include blood, which can carry a high concentration of the virus, especially during the initial and late stages of infection. Semen, vaginal fluids, and breast milk are also common transmission routes. The virus can be passed from mother to child during childbirth or breastfeeding if preventive measures are not taken. It's important to note that HIV is not spread through casual contact like hugging, shaking hands, or sharing utensils. The virus cannot survive long outside the human body, and it is not transmitted through air, water, or insect bites. When HIV progresses to its most advanced stage, it's known as AIDS, or acquired immunodeficiency syndrome. At this stage, the immune system is severely compromised, and the body becomes susceptible to opportunistic infections and certain cancers. At this stage, the body's immune system is severely damaged. Opportunistic infections, which are infections that occur more frequently and are more severe in individuals with weakened immune systems, can take hold. This makes individuals highly susceptible to opportunistic infections. These infections can be life-threatening and require immediate medical attention. Common opportunistic infections include tuberculosis, pneumonia, and certain types of cancers. While there is currently no cure for HIV, it is a manageable chronic condition with proper medical care. Early diagnosis and consistent treatment can significantly improve the quality of life for those living with HIV. Antiretroviral therapy, or ART, is a treatment that helps control the virus. ART involves taking a combination of HIV medicines every day. This treatment reduces the viral load in the body, helps maintain a healthy level of CD4 cells, and prevents the progression to AIDS. With adherence to ART, individuals with HIV can lead long, healthy lives. Many people wonder about the risks of HIV transmission through oral sex. This is a common concern, especially among those who are trying to practice safer sex, but may not have all the information they need. Understanding the risks involved can help people make more informed decisions about their sexual health. While the risk is lower compared to other sexual activities, it is not impossible to contract HIV this way. Oral sex is often perceived as a safer alternative, but it's important to recognize that it still carries some level of risk. Using protection such as condoms or dental dams can significantly reduce this risk. HIV can be present in sexual fluids like semen and vaginal fluids, which can come into contact with the mucous membranes in the mouth during oral sex. These fluids can carry the virus, and if they come into contact with any small cuts or abrasions in the mouth, there is a potential for transmission. These membranes are delicate and provide a potential pathway for the virus to enter the body. The tissues in the mouth are particularly susceptible because they are thin and can easily be damaged, even by everyday activities like brushing teeth or eating. It is crucial to remember that even if someone doesn't have any visible sores or cuts in their mouth, HIV transmission is still possible during oral sex. Microscopic abrasions that are not visible to the naked eye can still provide an entry point for the virus. Therefore, taking precautions and being aware of the risks is essential for maintaining sexual health. Several factors can influence the risk of HIV transmission during oral sex. Understanding these factors can help individuals make informed decisions about their sexual health and take appropriate precautions to reduce their risk. It's important to be aware of the various elements that can contribute to the likelihood of transmission. The presence of sores, cuts, or bleeding gums in the mouth can increase the risk of transmission. These open wounds provide a direct pathway for the virus to enter the bloodstream, making it easier for HIV to establish an infection. Regular dental checkups and maintaining good oral hygiene can help minimize these risks. This is because these openings allow the virus easier entry into the bloodstream. Even small, seemingly insignificant cuts or abrasions can serve as entry points for the virus. Therefore, it's crucial to be mindful of any oral health issues and address them promptly. The viral load of the HIV-positive partner plays a significant role. Viral load refers to the amount of HIV present in the blood and other bodily fluids. The higher the viral load, the greater the concentration of the virus, which increases the risk of transmission during oral sex. A higher viral load means there is more of the virus present in bodily fluids, increasing the likelihood of transmission. Regular monitoring and effective antiretroviral therapy can help reduce viral load, thereby lowering the risk of transmission. Whether the person receiving oral sex, the insertive partner, is circumcised or not, can also impact risk. Circumcision has been shown to reduce the risk of HIV acquisition in various studies, providing an additional layer of protection for the insertive partner. Studies have shown that circumcision can reduce the risk of HIV acquisition for the insertive partner during oral sex. This is because the removal of the foreskin reduces the number of target cells that HIV can infect, thereby lowering the overall risk. However, circumcision should be considered as part of a comprehensive approach to HIV prevention, which includes regular testing, safe sex practices, and open communication with sexual partners. Practicing safer sex is crucial in reducing the risk of HIV transmission during oral sex. Using condoms correctly and consistently during oral sex on a man can significantly reduce the risk of transmission. For oral sex on a woman, dental dams, though not as widely used, provide a barrier between the mouth and the vaginal fluids, offering some protection. Avoiding oral sex when either partner has open sores or cuts in their mouth is essential to minimize risk. Good oral hygiene, including regular brushing and flossing, can help maintain oral health and reduce potential entry points for the virus. Section 5. HIV testing and its importance. Knowing your HIV status is crucial for both your health and the health of your partner or partners. Regular HIV testing is recommended for anyone who is sexually active, especially if they have multiple partners or engage in higher-risk activities. HIV testing is relatively simple and accessible. Many clinics and healthcare providers offer rapid HIV tests that provide results in as little as 20 minutes. Early detection of HIV is vital because it allows individuals to access treatment sooner. Early treatment can significantly slow the progression of the virus. Section 6. PEP and PREP. Post-exposure and pre-exposure prophylaxis. Post-exposure prophylaxis, or PEP, is a medication that can be taken after a potential exposure to HIV to reduce the risk of infection. It's most effective when started within 72 hours of the exposure. Pre-exposure prophylaxis, or PrEP, is a daily medication that can be taken by individuals at high risk of HIV exposure to prevent infection. PrEP has been shown to be highly effective in reducing the risk of HIV transmission. Talking to a healthcare provider is essential to determine if PEP or PrEP is appropriate for your individual circumstances. Section 7. Breaking down stigma, open communication and HIV. Stigma surrounding HIV remains a significant barrier to prevention and treatment efforts. Open and honest communication about HIV status with sexual partners is crucial for making informed decisions about sexual health. Creating a safe and non-judgmental space for these conversations is essential. It's important to remember that people living with HIV deserve compassion and understanding, not discrimination. By challenging stigma and promoting open dialogue, we can create a more supportive environment for individuals affected by HIV. Section 8. Seeking reliable information. Your resources for HIV and sexual health. Navigating the world of sexual health information can be overwhelming. It's vital to seek information from reliable sources like healthcare providers, reputable health organizations, and government websites. Your doctor can provide personalized advice based on your individual risk factors and sexual health needs. Organizations like the Centers for Disease Control and Prevention, or CDC, and the World Health Organization, or WHO, offer evidence-based information on HIV and other sexually transmitted infections. Section 9. Conclusion. Prioritizing sexual health in the face of HIV. Taking charge of our sexual health is paramount, especially in the context of HIV. By understanding the modes of transmission, practicing safer sex, getting tested regularly, and seeking accurate information, we can make informed choices to protect ourselves and our partners. Remember, knowledge is power. The more we know about HIV and how to prevent its transmission, the better equipped we are to navigate our sexual health with confidence. By prioritizing our sexual health, we contribute to a healthier and more informed society.